Hello friends, let's see the anatomy of the male urethra. Male urethra is a common tubular passage for the semen and urine in male. Male urethra extends from this internal urethral orifice which is situated at the neck of the bladder to the external urethral orifice which is at the tip of the glans penis. When we see the course of the male urethra, it is a sinusoidally curved course. And this male urethra having three parts according to their site of location, and the first part which is situated within the prostate gland, and this part it is called as the prostatic urethra. The part of the urethra it passes through this urogenital diaphragm that is called as the membranous urethra, and the part of the urethra starting from the urogenital diaphragm to the external urethral orifice which passes through the penis that is called as the spongy part of the urethra. The spongy part of the urethra it is also called as the penile urethra, or it is also called as the bulbar urethra. When we talk regarding the length of the urethra, on an average it is around 20 centimeter in long. Out of them, the prostatic part having 3 centimeter length, this membranous part having 2 centimeter length, and the penile part or the spongy part having 15 centimeter length. On an average, the breadth of the male urethra it is 6 mm, but the highest breadth which is present at the prostatic urethra and it is around 8 mm. The minimum breadth is present at the external urethral orifice and it is around 4 mm. The next to minimum breadth is at the membranous urethra which is around 5 mm. So all these are the dimensions of the urethra. Now let's move on to the shape of the lumen of the urethra. When we take cross section at the level of the prostatic urethra, the lumen of the urethra looks like crescent shape, and this crescent shape having the convexity anteriorly. At the level of the membranous urethra, the urethral lumen looks stellate in shape. At the level of the bulb of the penis, the spongy urethra having the lumen that is trapezoid in shape. At the level of the body of the penis, the lumen of the urethra is in the form of the transverse slit. At the level of the glans penis, the lumen of the urethra it is in the form of the inverted T-shaped. And at the external urethral orifice, the lumen of the urethra it is in the form of the vertical slit. So here, this is the urethral lumens on the cross sections. Many MCQ can be asked from the shape of the urethra. This different shape of the lumens at the different level that is responsible for the spiral outflow of the micturition, and this will prevent the separation of the droplets of the urine during micturition. Now let's move on to the description of the different parts of the urethra. When we talk regarding the prostatic urethra, this prostatic urethra it extends from the internal urethral orifice to the upper part of the urogenital diaphragm. It runs within the prostate. It runs at the junction of the anterior one-third part and the posterior two-third part of the prostate. As we already discussed, this prostatic urethra having maximum breadth among whole male urethra and it is around 8 mm. In case of the sagittal section, we can see that prostatic urethra it is fusiform in shape, and the cross section, as we have already discussed, it is crescentric in shape with the convexity anterior side. Here in this figure, we can appreciate this bulging, and this outpouching or the bulging on the posterior wall of the prostatic urethra, it is called as the prostatic utricle. This prostatic utricle is the homologous part to the vagina of the female, because this prostatic utricle, it is also going to be developed from the two caudal part of the Mullerian ducts. In case of the caudal part of the Mullerian ducts, in case of female, this structure gives rise to the formation of the vagina. So this prostatic utricle, it is the homologous to the vagina, and that is the reason why this prostatic utricle, it is also called as vaginalis masculinus. Now let's see the interior of the prostatic urethra. For that, we have to take one coronal section of the prostate and try to see the posterior wall of the urethra. So here in this figure, we have taken the coronal section of the prostate at the level of the urethra and try to see the urethra from the posterior wall. So here we can see the posterior wall of the prostatic urethra. Here we can appreciate that on the posterior wall of the prostatic urethra, there is one mucosal fold in the midline, and this median longitudinal mucosal fold, it is called as the urethral crest. And this urethral crest, it is the continuation of the trigonal muscle of the bell of the urinary bladder. As this urethral crest is the elevation which is situated in the midline, because of this elevation on the each side of the urethral crest, we find one gutter, and that sinuses they are going to be formed. These are called as a prostatic sinus. Within the prostatic sinus, we can appreciate openings of the so many prostatic glands. Now within the midline, in the line of this urethral crest, we find this elevation, and this elevation, it is called as the colliculus seminalis. The other name of this colliculus seminalis, it is the verumontanum. Within this collicus seminalis in the midline, we find one larger opening, and this opening, it is the opening for the prostatic utricle as we have discussed. And on the each side of the opening of the prostatic utricle, we find two more openings, and these are the openings of the ejaculatory ducts. These ejaculatory ducts are going to be formed by the fusion of the duct of the vas deferens and the duct of the seminal vesicles. So here in the previous figure, we can appreciate that here this one is the vas deferens, and here this one is the seminal vesicle. Duct of the vas deferens and the duct of the seminal vesicle is going to fuse and form this ejaculatory duct, which open on the each side of the prostatic utricle within the colliculus seminalis. Now let's see the detailed anatomy of the membranous urethra. As we have already discussed, this membranous urethra is the continuation of the prostatic urethra, and when this urethra passes through the urogenital diaphragm, this 2 centimeter long urethra, it is the membranous urethra. And this membranous urethra is the most common site for the rupture of the urethra. The second minimum breadth is also present at the membranous urethra. It is around 5 mm. And the lumen of the urethra at the membranous part, it is stellate shape. Now let's move on to the third part of the urethra, that is the penile part of the urethra or spongy urethra. This spongy urethra, it is around 15 centimeter in length, and we have seen the shape of the urethral lumen at the different level of the spongy urethra in the previous part of our lecture. The spongy urethra having two dilatations. One dilatation, it is situated somewhere here at the bulb of the penis, and this is called as the intrabulbar fossa. At the bulbar part of this urethra, or we can say at the infrabulbar fossa, we find the opening of the duct of this bulbourethral gland. So this bulbourethral gland, it is going to open into the bulbar part of the spongy urethra. The second dilatation of the spongy part of the urethra, it is at this level, and this one is the fossa at the glans penis, and that is called as a navicular fossa. This navicular fossa, it is situated at the terminal part of the spongy urethra, and that's why it is called as the terminal fossa also. In case of the whole length of the spongy urethra, we can appreciate the opening of the smaller urethral glands, and these are called as the urethral glands of Litter. Just near the terminal fossa on the dorsal aspect, we can appreciate one urethral gland is large, and that is called as the lacuna magna. At the lacuna magna, we appreciate one valve over there, and that valve, it is called as the valve of the Gurin. Now let's move on to the structure of the urethra, but mainly we will concentrate on the mucosal lining of the urethra. The lining epithelium of the prostatic urethra above this colliculus seminalis, it is lined by the transitional epithelium, just like that of the mucosal lining of the urinary bladder. The lining epithelium of the remaining portion of the prostatic urethra, whole membranous urethra, and the part of the spongy urethra up to this glans penis, this area, it is lined by the stratified columnar epithelium. While the part of the spongy urethra within the terminal fossa and at the external urethral orifice, this area is going to be lined by non-keratinized stratified squamous epithelium. Now let's see the sphincters of the urethra. There are two sphincters of the urethra in case of male and only one sphincter in case of the female. So the sphincter which is situated at the neck of the bladder at the internal urethral orifice, this sphincter is called as the internal urethral orifice, which is present only in the male. This internal urethral sphincter is going to be formed by the middle circular layer of the detrusal muscle of the urinary bladder, which is purely involuntary in nature and is responsible for the prevention of the backflow of the semen during ejaculation. The second sphincter which is present at the membranous urethra, and that sphincter it is called as the external urethral sphincter. This external urethral sphincter, it is going to be formed by the sphincter urethrae muscle of the urogenital diaphragm, and this is purely voluntary in nature, which is present in the male and female both. This external urethral sphincter, as it is voluntary in nature, a person can hold the urine when there is no suitable environment to void it. So this is the sphincters of the urethra. Now let's move on to the arterial supply, venous drainage, lymphatic drainage, and the nerve supply of the urethra. When we see the arterial supply of the urethra, it is going to be supplied by the inferior vesical artery, middle rectal artery, as well as the branches of the internal pudendal arteries. Corresponding veins of these arteries, they are going to drain the blood from the urethra. When we talk regarding the lymphatic drainage of this urethra, the prostatic part as well as the membranous part of the urethra both are going to drain into the internal iliac and the external iliac lymph nodes. While the spongy part of the urethra, it is going to be drained into the deep inguinal lymph node. When we talk regarding the nerve supply of this urethra, it is going to be supplied by sympathetic nerve, parasympathetic nerve, as well as the somatic nerves. The sympathetic supply to the urethra is from L1 and L2 spinal nerves, while the parasympathetic supply to the urethra is from S2, S3, and S4 spinal nerves via pelvic splanchnic nerve. And the somatic nerve supply to the urethra is from the urethral branches of the pudendal nerve. So here we have completed the anatomy of the male urethra. Hope you understand well. Thanks for watching.